So Dr. Lincoln Harris, founder of Ripe Global, is a true dentisting superhero. Lucky to call him a friend. He is taller than me. I am funnier than him. That's my rating. He is coming to Philadelphia in April, this April, to share with us how to improve clinical efficiencies, how to feel more confident, how to connect with patients for case acceptance, and most of all, how to feel better about what we do each day. It is not easy to be a dentist. I was at my office yesterday. Whether you've been a dentist for 2 years, 12 years, 22 years, longer than I've been alive, inside that operatory, it is you, the patient, and your assistants, and your confidence is so key to success. If you're watching here on Zoom, feel free to ask a question about clinical efficiency, class 2 composites. However we can help you as we wait for Link to come back in. We'll keep watching this course.
Except veneer preps. So the way we do this is you sink the burr on one end of a quadrant. If you're doing a quadrant, you sink the burr to the depth that you require. So if you need 2 millimeters of reduction, you get a 2 millimeter burr and you sink the burr until it's flush with the top of the tooth, which is what you do to do a depth cut. But instead of taking it out and doing another depth cut, you hold the burr at that level and then you just slowly drive along, which if it's a tooth, the entire tooth. If it is a quadrant, you do the entire quadrant. If it's front teeth, you do 6 front teeth. So you can do incisal reduction of 6 front teeth.
Link is back. Let me know when you are good, Link. We're enjoying your soothing discussion of why you don't do depth cuts. That's very spicy. Depth cuts were a big part of my life in dental school. So if you were, I don't know if you can hear me or not, Link, but we can see you. I'll still kind of catch everybody up that we are talking with Dr. Lincoln Harris, founder of Ripe Global, not just sponsor. He has an amazing training program to help you with posterior dentistry, anterior dentistry, full mouth rehabs, implant dentistry. You can learn how to join that program by texting RIPE, R-I-P-E, to 215-543-6454. And you'll get not only a link to learn how to learn, but also a discount code from us. We're also sharing. The link will be in the United States in April for leveling up your clinical and confidence game. We're going to talk about the business of dentistry, class 2 composites, efficiencies, not crying inside when you're a dentist. My Nacho team is on here, both on Facebook Live. If you have any questions about attending this event, you guys can tag some of the people that will be at this event. My Awesome Nacho team, Bob D, Glenn Vo, Laura Brenner, Alan Stern. We have dentists coming from around the social media world to have fun, make new friends, most of all, eat great food in Philadelphia. So I'm going to keep playing Link's course here just for a second while we wait for him to get settled, and we'll have him back on in a minute.
In about a minute. You just drive from one tooth all the way along. Now, what does this do? To be able to do this, you have to have the feel of the maximum rate that a diamond burr can munch through tooth. You can't push diamond burrs too hard because they actually have a maximum rate. And if you push them harder than that, they start coming out of the tooth. And so the movement is actually not that fast. So you hold the burr there and you're moving it forward, controlling the depth, and you will feel the limit when the burr starts to lift out of the tooth. Now, this takes practice. That's why we have plastic teeth.
So, Link, through the power of YouTube, we are listening to you from 2 years ago. Can you hear us here in the updated world? Are you still waiting to get connected?
Yeah, you know when you do that Zoom thing where you turn Zoom on and it wants to update and then you got to change the password, and
we see you. We see you fine though.
Yeah, it's just not on my proper camera, which annoys me no end.
Stop your video. We'll play your soothing sounds for us. People are learning from your course. So give me a thumbs up when you're ready to talk. I'm just see you back here.
Yeah, I'll try one more time. Otherwise, I'll just use the old camera. And what you're trying to do is not prep the tooth 50 times. You're trying to prep the tooth once. So mostly, particularly when people are using air turbines, they prep the tooth about 50 times. So you'll see them going backwards and forwards, backwards and forwards, backwards and forwards. And that process of going backwards and forwards is to shave the tooth down bit by bit. And the effect of that is that you are prepping the tooth 10, 20, 30, 40 times. So what I'm trying to train my students to do is do the prep once as fast as possible, but it's better to prep the tooth slightly slower and only do it once than to prep it quickly and 50 times. So you sink the burr in and then you drive the burr to the other end of the tooth, or you drive the burr to the other end of the quadrant. And then obviously you flip the handpiece over and you do the other side. So once you have done that, and I do the secondary planes as well. So, you know, I'm just going to run along the tooth, take out both planes, and then if there is contacts, I'm going to break the contacts. It just makes it easier to see where the margin of the tooth is. And then, of course, if there's old restorations, I'm going to remove all of the old cores. I'm going to dismantle everything. Now, I don't generally go around the tooth and do any sort of axial prep until I have done occlusal reduction and until I have dismantled and removed all of the old restorations. And the reason for that is it's the minimum number of preps. If you prep the entire crown prep, right down to the gingiva, all the way around axial, occlusal, and then you do a core build-up, you now have to prep the entire crown prep again. But if you just do occlusal reduction, take out any restorations, then do a build-up, the only bit that you have to repeat is the occlusal reduction. And it stops you using as much core build-up material because any remaining structure that's there doesn't need to be core built up. And so then you go from there and you finish your occlusal reduction and you drive around the tooth axially and you do the remainder of the prep. So that is the most efficient way. So obviously these preps had previous crown preps done already, so it's more of a fix-up. And it's one of the exercises I do, which is to get people to build preps and destroy them and then make them again. So core build-ups and then the final. So now, if you do this enough, you should be able to do a prep that looks like this. So a very fine prep, which is very difficult to do in about 20 minutes. Actually, most students can do that in about 10. Now, this list is for some reason.
This is part of our fun live CNTV. We have a question I want to share at this moment because I know there'll be great questions. It is really helpful / necessary to write them put your questions in the Q&A because we don't always see them when they're in the chat. The chat is like a river filled with nachos flying by. So put them in the Q&A. But for this nice dentist, I will ask Link, what would be the benefit of doing the core buildup after the occlusal reduction? Why would you not want to do it first?
So if you just prep everything out and then do the core buildup, then you will get, first of all, you have more shrinkage issues because you now have a much deeper cavity. The second thing is you have to use a lot more core buildup material because you have to fill up. That last bit of the occlusal portion is about 5 times the volume. The 5 steps that I follow to...
So Link, I would like to report that you look great to me from there, but we see you.
Now I can't even find where you are.
We're sharing.
What happened? I can't even find the actual call now.
We see you though. You could hold up a certain number of fingers, and I'll tell you how many you have, and then not just the one special one. So I'll keep playing your course. We're here to chat with you. I want to catch everybody who's watching. This is a segment of Dr. Lincoln Harris's Better plus Faster Crown Preps. It's one of our most popular training videos that he has shared with us at Dental Nachos. Dr. Lincoln Harris is coming to Philadelphia in April for leveling up your clinical and confidence game. What Ripe Global does is truly amazing. They're fantastic sponsors of what we do. If you would like to learn about their training programs, text RIPE, R-I-P-E, to 215-543-6454, and we'll send you back how you can be part of it and get a discount code. As we're catching up with Dr. Lincoln Harris from Australia, I'm here in Center City, Philadelphia. If you have any questions about clinical confidence, competency, and efficiency, please feel free to drop them in the chat. As Link gets himself prepared, we're going to ask a little bit about how he conducts his day on a day-to-day schedule. My Nacho team is here on Facebook Live too.
Cool.
So
Let's go for it.
you give me a thumbs up. Can you see me? All right, cool. So what I'm sharing with our audience here on Dental Nacho's Facebook Live and on Zoom link is a previous course that you shared, which is one of the most popular ones we've done on better plus faster crown preps. We're going to talk about a variety of things with you coming to Philadelphia in April. To learn how to register for that event, text link LINC to 215-543-6454. But let's just deliver value to start, Link. There's been a lot of spicy talk on my group saying, Paul, you're encouraging dentists to work fast and not care about their results. And I've said, I haven't said that at all. But sometimes dentists think faster means you're going to do a worse job. Share with us a little bit about what you think efficiency means, why it's important to the dentist, patient, and assistants, and why your training programs are dedicated to helping dentists with that.
There is some truth in the fact that you cannot squeeze a procedure down and down and down in time without having an impact on the output. So that is true. And the example I would give is technically you could drive down the freeway or the interstate at 150 miles an hour and you would probably get there faster, unless something went wrong, in which case you would never get there at all because you would be in jail, dead, in an accident, hospital. So there is many things you can do faster, but as you go faster and faster, your tolerance for anything outside of routine becomes less and less. So you have less capacity to cope. However, there is absolutely true that you can become much faster at many parts of a procedure, which gives you two opportunities. Opportunity one is to be more efficient, and the end result of efficiency is to be more productive, and that basically means earn more money. The second thing that efficiency gives you is it takes the time in the parts of the procedure that you can make faster way down, and it gives you more time to make the bits that are time consuming better. So when you come, an example of this would be a cosmetic case. So if you're doing cosmetic veneers, I can prep really fast, but my appointments are still a similar length to what they used to be. The difference is now that the veneers that I produce are massively more beautiful, and people will pay more for that. And I get patients who come to me who are dissatisfied with someone else. And the speed that I've developed in the prep has given me more time to make sure the mock-up is correct and the photography for the lab is correct and the shade guides are correct and the temporaries are correct, so I don't have bad gums the next time. So what I've done is I've taken the prep time and I've squeezed that right down, which has given me more time to do all of the other steps that are often done under pressure, which actually make more difference to the outcome than the prep. The prep is actually the one part of dentistry that you can get faster and faster and faster at over your career. The overall procedure may or may not get faster. It depends on what you're trying to achieve. And so an example of this would be, I'm not particularly fast most of the time. Let's take a composite resin or a composite, as you like to say.
Yes, so, speak our way, Link. You're getting ready for Philadelphia.
Sure. Start using my R's on everything. So I'm Australian. So Australia, basically, we don't have the letter R in the alphabet. So that's why, you know, we just skip it and we switch it for a H. So I don't try to be particularly fast most of the time because I've built a practice where I can charge people enough to take the time if I need to. But I can be, if I turn my camera off and stop documenting step by step, and, you know, I go, okay, today I'm not going to be fancy. Today I'm just going to be efficient. I can be very fast. Because if you can be efficient with all of the overhead of taking photos and teaching, and you have to have things to a gold standard because everyone on the internet will criticize the tiniest little speck of stain on my prep. which is actually not probably clinically relevant. But if I go, okay, today I'm just going to be regular dentist, because I've trained at that level to do that thing. If I go, okay, today I just got to smash it out and do things fast, I'm very fast.
And I want to interject, I like this link. I want to interject as someone who has multiple associates, and we're going to be talking, and I was a young associate and worked for my dad. You know, we're just looking at this crown prep that you've done, and the crown prep is a core chip of every practice on the globe who's a general dentist. And I'll just say that when an associate takes twice as long as the owner dentist to do a crown, even if it's done at the exact same skill level, we'll just hear that, patients lose confidence when things take too long. Talk to our audience a little bit about that. I've dealt with that personally as a young associate. I've had to train my associates. How do you manage your associates and the people that you teach? And we'll just stay with the crown on patient confidence related to clinical efficiency.
So that's a really good question, because actually one of my associates recently took over a patient that I just couldn't fit in for weeks and weeks. And it's a slightly anxious patient. And then he basically just about walked out on her because she took a longer time and so on. Now, to be fair to her, it was probably the most difficult tooth. So I've done more easy teeth in his mouth, and the first one she's done is the most difficult tooth in his mouth. But I sometimes take a very long time to do a difficult crown prep. Not as long as an associate, but sometimes it takes me a long time. So there's three things that give people confidence. The first one is your demeanor. So one of the big differences between me and you and a young associate is that if a tooth is difficult, you and I are likely to say this will be a difficult crown prep before you even start, because one of the things that's really hard to do is to predict a difficult procedure before you start, because you have to be very good at procedures to be able to pick a difficult one. So that's the first thing. So you and I will go, this is going to be difficult. It's going to take longer than usual. An associate will almost not be able to do that. It's impossible, because that takes experience. The second thing is that when something does go wrong and it's difficult, an experienced person like you and me will remain calm. Okay. And an inexperienced or poorly trained person will start to get flustered. And it's actually the fluster, the transfer of anxiety from the dentist to the patient that makes the patient really anxious. Yeah. So like I sit there, I do things that go wrong all the time. Like literally, I've been posting cases recently of things that have gone wrong, because no one ever does that. And they all live in this like pretend world where 100% of my crown, one of the things I like to show is that sometimes I do a crown and the patient has sensitivity and I've got to cut the crown off and do it again because it's a bonding issue. Happens. So, but when that happens, I'm not flustered at all. I'm just, you know, sorry, but something happened to the screen there. Is that on purpose?
I moved along your tier. I want to bring him another picture. It was me.
Yeah, no worries.
Yeah.
So so you and I don't get flustered, and it's not the speed that matters. It's that we do each step with purpose, and we get it done, and we move to the next one. So if you took twice as long, your patients won't be affected by that, because you move with purpose. But when you're not trained properly, you don't move with purpose. You're just doing this, and you're doing a bit of that, and you're flopping about. The best example is new graduate doing an extraction that goes wrong. They're picking a Coupland's up and they poke at it and they put it down. They pick a luxator up and they poke at it and they put it down, and they grab it with the forceps and they put it down and they get the luxator back, and then they're actually doing nothing.
Yeah, I want to interject, Glenn, because you're saying such good things. I want to make sure I want to make a post about this later. The three things that impact patient confidence, you're saying demeanor, calmness level, and flusters, or was that the same one, or was?
So no, the three things is, number one, we will recognize a difficult
person. Basically managing expectations. And I just want to tell a story because I love this story. So my dad did the Air Force and he took out a lot of teeth. And at the end of his career in his life, occasionally he would take out a tough tooth. And I say, Dad, do not do this tooth. it's going to be a nightmare. So he would do it on a patient they'd seen for years. And I'm not joking. Like one time they were in there for like 97 minutes. And I walked in and I said, Dad, what happened? And the patient looked at me and said, your dad's still undefeated, right? So he was thrilled because the trust level in my dad was high. But if that was our new associate and the same outcome happened, he wouldn't see them again. And that, I think it's important that we bring this to light, because identifying the challenging nature of the procedure is very difficult to do. And how do you actually, I know you're going to be coming to talk to us at Philadelphia, do Ripe Global. We're just giving people a taste test, but maybe I just want to ask you that, like, how could someone listening to this live with us or on demand say, evaluate procedures difficulty level better? Is that if I'm phrasing that right?
So that, I have a whole portion of a lecture on that. And so it's simple stuff. Like when you look at the radiograph, look where the caries finishes and look how many millimeters is it from the bone.
Yeah.
This is difficult dentistry identification 101. Look at the distance between the crestal bone and the most apical portion of the caries. If that's 3 millimeters or more, this is a straightforward case. If it's 1 millimeter or less, this is an extraordinarily difficult case. You need to add 20 minutes to the appointment, otherwise you will run late. You need to be mentally prepared to cut all that tissue away with a burr and spend 5 to 10 minutes controlling the bleeding.
Yeah.
If you do that, this will become a straightforward case. If you put that in the same crown prep time as anyone at home, doesn't matter how fast. So let's say you're crown prep guru of the world and you run around the world teaching the 5-minute crown prep. If you hit a case like this, it's still going to take 10 to 20 minutes longer. And so your 5-minute crown prep is now 25 minutes. Because the 5-minute crown prep is based on a person who has perfect periodontal health, who hardly needs a crown, has an amalgam that's super gingival and has a few cracks in it, and probably doesn't need the tooth crowned anyway. So most of the cases, like when I see people doing really fancy things, they're on these easy cases that hardly even need the work. And if you look at the cases I do, they're like caries everywhere, and it's down to just about their toes. Like,
and I also want to share this link. We're giving us such great value, and you could even describe what's happening in this picture a little. There's someone else in the operatory that I believe efficiency benefits that gets left out of these conversations. And that's your dental assistant, right? So your dental assistant has many patients to see, instruments to sterilize, things to do. And if you can finish a procedure at the same competency level or same outcome faster, it helps them. What do you think of that person in the operatory who benefits from efficiency?
Yeah, so the dentist, a dentist without a good assistant is obviously going to be 4 times slower. So yeah, something like this. So a dentist, go in on the Saturday on an emergency on your own and you'll understand how slow you are without an assistant. It takes you 2 hours to look at someone's tooth because you can't find it.
Yes.
Then, so to do a crown without a dental assistant would take you 3 to 4 times longer. So already your assistant is crucial to your speed. And then if you work in a practice where they rotate the assistants every second day or every week, then your assistant will take about 50 times longer to get fast. So one of the most common complaints when I talk to people who have DSOs from the dentists who work there is that they say, my assistant gets rotated every single week, and so they're never any good. But if you are on time, like if you run smoothly, then it makes your assistant's life less stressful. And if you have routines that you follow, then they know what you're going to do next. So someone came and watched me on Monday, one of my students from an Australian one, she came and watched me on Monday and I did 4 crowns that day, just singles, not anything fancy, just single crowns. And they were difficult. Like they were subgingival, they were bleeding, just standard stuff. And I said, what did you notice? And she said, you just do things. First thing she said, I notice you don't use very many instruments.
Yeah.
You have a very small selection of instruments and you use a very small number of things. And my assistant, who normally assists one of my associates, said the same thing. She said, actually use half the number of instruments of the other associate that she normally works with. And then she said, you follow the same routine. It's just like this mindless pattern that you follow. So we teach people these patterns. Like, step 1, get them numb. Step 2, chop the top off the tooth. Get rid of the occlusion, because now you can see better, and if you have to do a core buildup, the core buildup is smaller, so you save on materials. And then 3, control the tissue so it's not bleeding. Take as long as you, and each step do it perfectly so you don't have to go back. So it's better to spend 5 minutes controlling tissue and actually have it stop bleeding than to spend 1 minute controlling tissue and now it's still bleeding, and for the rest of the appointment you're getting bothered by blood. And so
you said something good, and I actually made this error many times, where whether you use cord soaked in some sort of blood stopping agent, whether you use Teflon tape, once you pack the cord, what should you go and do before you take that impression?
Go on Instagram and troll some people, or do something. Do something for 5 minutes. But actually, the main thing is set a timer, because 5 minutes, it's like, I'm pretty sure that there's some self-etching bonding agents that say you need to put them on the tooth for 30 seconds, because they know that if they say 30, the dentist will probably do 10. If they say 10, you'll probably do 2. You'll go, 8, 9, 10, right? We're good. Okay, so 5 minutes it takes for the retraction cord to work. If you don't put retraction cord in for 5 minutes, as soon as you pull it out, the tissue will collapse. And then you try to take an impression, and then your impression's no good. Or you try to take a scan and your scan's no good. And then you try and scan it again, and then your crown doesn't fit. And so if you don't get that first step right, every other step after that is difficult. My builder taught me this. So on my house, there's a row of bricks that goes all the way around the house, and they put so much effort into that. And I said to the bricklayer, why are you putting so much effort into a row of bricks that has no structural value? He said, Link, every single window in the house will have to be squared up to these bricks. He says, if I don't get this perfectly straight, the builder will have to custom trim every single piece of wood. I've got wood siding on the house. Every single piece of hardwood that goes on the outside of your house will have to be custom fit. And every single window will have to be custom fit because I didn't get the bricks straight. He said, it will make the rest of the house take 3 times longer to build. And that's how dentistry is. We don't spend enough time on the first layer of bricks, and then we spend 3 times longer trying to fix it up for the rest of the appointment. And that's because we panic.
Yeah, well, I was just going to share it, Lincoln. We're going to talk a little bit about the event in a second, but what you've even shared today with things like, is the decay 3 millimeters more or less away? That's a clinical tip, but it sounds like mindset and managing is it actually managing your emotions inside the operatory is the part where most dentists go sideways and either take too long, have bad outcomes, get the patient upset. I mean, is part of your training for your associates what you do about their mindset inside of the operatory?
Yeah, so actually dentistry is all about self-discipline, and it's actually a mental game. It's not a technical game. The technical game takes training, but to do something in a relaxed manner is very easy. So like when we're doing CPR training on a mannequin, okay, easy. Everyone can remember their staying alive while they're doing compressions. If you actually have a patient drop dead in your chair in the middle of a procedure, you will suddenly find that CPR is much, much more difficult to remember because stress takes away our mental capacity. So what you actually need to do, the mistake that most education makes is it trains you to be good enough to do something in the easiest possible situation you can imagine. And every other situation after that education will be more difficult. So what we do is we train you in a very difficult situation so that at least it matches the first patient you really see, or it's even the first patient you see is easier. So this is the fundamental difference between training and education.
I like that, Link. It's a
teaches
great,
you for an ideal scenario, but then the moment you see a real patient, they're not ideal. Like you will do a training on a bench top with a model that has no cheeks, that you can rotate from any direction,
yeah.
has no tongue, whatever, okay? And then your first patient Monday morning will be a chubby person with a fat tongue who's a gagger and is really jumpy and goes, I hate dentists.
And then we also, it's a thing, it's that feeling in the stomach you get when that person leans back and you go, this is going to be brutal. Next time is. So I want to just kind of wrap us up for 5 minutes or so, Link. For everyone listening, my team included, you have an amazing team at Ripe Global. We talked with them yesterday. You're coming to Philadelphia. There's a 3-day event. I want you to just describe on the Saturday when we have this advanced treatment planning boot camp, the people in that audience, the dentists, the associates, the team members, what will they learn from you at advanced treatment planning boot camp?
Have you ever got a patient where you take one look at their mouth and you go, I don't know what to do?
Yeah.
I need to sit back and think about it. And then you think about it. And as you start thinking about it, you go, should I do root canal therapy? Should I extract the tooth? Should I do an implant? Should I do a bridge? Should I do perio? Should I do all on 4? And you just go round and round because you have hundreds and hundreds of decisions to make for so many teeth. And then how will you talk to the patient about the cost of this? Because it's going to be $25,000 or $35,000. Yeah. Very uncomfortable. So what we will do on that Saturday is we are going to smash through difficult cases one after the other until you can make those decisions quickly, effortlessly, and with confidence.
I mean, people from that's amazing. People from Dental Nachos through our collaboration sponsorship, they're already signing up for your Ripe Global training from their operatory. We have plenty of content. They do reps on real models in their operatory. That's real training. What you're going to do on Saturday, it sounds like, is train us to make decisions. Is that right? That's what we can do in a conference room, is decision training. Am I on the right track with that?
Absolutely. So if you talk to, so someone comes in, their teeth are all worn down, okay, and they go, I'm concerned about the wear, but I don't want to spend much money. Difficult, okay? What do? Most dentists go, I don't know what to do. They say they don't want to spend much money. So how do you find out how much money? Because a lot of people say, I don't want to spend much money. Well, then spend $30,000.
Right.
Okay. So we will learn, one, how to find out what the patient's actual goal is, not their chief complaint. Completely different. The chief complaint is almost irrelevant. The goal is what matters. And and dentists will not tell you their goal unless you ask. So that's what we're going to teach. Number one, that. Number two, what do we actually do? And we will learn to plan like an architect. Start with the look, the function, and then work out engineering and plumbing later. Most dentists start with electrical, plumbing, foundations, and then they end up with an ugly looking house on top. Yeah. And then 3, we will break the fear of both making decisions and talking about money.
It's key. I mean, we can't wait to that in Center City, Philadelphia, seeing you live in person. To join us, text LINC, LINC, to 215-543-6454 to register. Visit us at dentalnachos.com. This is Dr. Lincoln Harris, founder of Ripe Global, an amazing 80,000 plus member online community and a training program that we're proud to collaborate with as a sponsor. Text RIPE, R-I-P, to 215-543-6454 to learn more about that. Before we wrap up, Link, what are you looking most forward to eating in Philadelphia when you're here for 5 days with me? We're going to have like almost every meal together.
Okay, so what I'm most looking forward to is you taking me on an adventure. So far I've been to the fancy French place, and I've been to Velvet's twice, and I've been to the nice pizza place. So I'm looking forward to what you're going to show me next.
We're going to bring, you want to side a food adventure there. We will do that on Wednesday. Get here early enough on Wednesday before it starts. There's some gritty neighborhoods in Philadelphia with world-class cuisine, kinds we haven't had yet. So we'll do that. Well, Link, hang around. Nacho Group, you do not want to miss this. Lincoln Harris is awesome in so many ways. He's funny, he's fun. He'll help you dentist better, treatment plan more efficiently. Join us in Philadelphia. Thanks, Link.